Okay, so we talk about the cervical vertebra, right? And how the cervical vertebra will have transverse foramen. Thoracic vertebra will have attachment points for the ribs, the facets and demifacets, which we talked about a little later. Talked about the lumbar vertebra. Here's our caudal vertebra, and we talk about how the first ones look like little lumbar because they're anchoring the muscles, and then they get simpler in construction as we work more distally. Talked a little bit about the sacrum. I thought it'd be worth looking at the sacrum. Now here's a kitty cat sacrum, and this is kind of a cool one. This doesn't look right here. And that's because this cat had osteoarthritis. And you can see this bony growth here. This cat's hips were at an angle, little extra bony spurs, so like here. So this cat was probably in a little bit of pain when it finally passed away of old age. But here we can see a kitty cat sacrum in the first caudal vertebra. A lot of times it's hard to see a lot of features on these teeny tiny little specimens. So sometimes it's helpful to get another specimen. This is a sacrum from a deer. Here we have one from a pig that I showed you before. And of course, here is a hamster. So before we go into the special features of sacral vertebra, let's take a moment to review basic vertebral features, because they're all here. So here's our centrum or body. Here's the vertebral arch. Base of the arch, pedicles. Sides and roof, lamina. Dorsal spinous process. Cranial articulating process, and there's the cranial articulating surface, right? And the surface, the processes off to the side, dividing this animal up into cranial and caudal portions, as you already answered, are transverse, right? So we've got all that here, and it's a little hard to see, like, let's see, which else shows it better? None of them. So it's a little hard to see, but you do have cranial and caudal articulating processes meeting, etc. But everything's fused together to make it a better structure for anchoring the pelvic limbs, the pelvic girdle. And that's what we're seeing here, right? Here we can see how our sacrum is articulating with the pelvis. In fact, this bone of the pelvis is the ilium, and this is called the sacroiliac joint. Right? A lot of times joints are named for one bone and the other bone meeting together, you know, like the Georgia-Florida border. So what we see is these structures are fused together, and they're given some unique names as a result of it. So you'll notice that our spinous processes form a linear elevation, right? We call a linear elevation a crest, just like the crest on a helmet. And so since this is on the sacrum, it's surprisingly called sacral crest. With a lot of imagination. But you'll notice we have multiple linear elevations here, right? So the one right along the midline, what's the term for something along the midline? So this is new with the masks. I can't tell if you're mumbling because you don't know the answer and you want me to think you do, or the mask is blocking you like Kenny from South Park. But I'm assuming you knew it and were blocked. So median, right? So median sacral crest. But it's going to vary. Like with our piglet here, not much of a median at all, is there? We're going to have one off to the side. What's the side of something called? Lateral, good. That's why the big V muscle that's in your torso is called latissimus dorsi, the lateral muscle of your trunk dorsi. Okay? So here we have our median, lateral, and for a lot of these animals, like this deer here, here's our median, here's our lateral, and there's one that kind of blends in with the lateral in between. Something between median and lateral is called intermediate. So we have partially three sacral crests here. Humans have all of those showing really nicely because walking upright has changed the anchoring of muscles. I think you're getting a phone call.
No, that's you.
I don't have a phone call. I'm ancient. Oh, it is. Well, that's odd. My wife must have left my phone on. She plays it on it all the time through the window. Great, so I wonder what my battery power is. Here we have our transverse processes. And the term for this, you see how it looks like the wing of a bird? So the descriptive term for that is ala. Ala refers to wings. One of the words we'll see a lot for wings. So later on you're going to be looking at the bones of the skull. And there's a bone that goes into the orbit shaped like the wing of a bird called the ala sphenum. Another wing word we'll see a lot is pterygo, like pterodactyl, wing finger. So ala is the term for this wing-like surface. However, our transverse processes fuse together to form a nice surface for articulating with the pelvis. So we call that surface we see right here, the articular surface. In fact, this deer shows it really nicely, which is why it was tagged on the test. There's the articular surface. That's actually where the sacrum and ilium meet. So when you look at the ilium, you'll see a surface that matches up with that. In humans, the articular surface is shaped like this part of your ear, which is anatomically called pinna or auricle. Yeah, now once we can understand these names, they're really not that impressive, like seals. Pinniped, which means ear foot. Yeah, not the most popular caveman name. So the term for the articular surface that you sometimes will see will be auricular. Interchangeable, that's where you get to choose. You want to use auricular, that's fine. You want to use articular, that's fine. Either one would work, whatever you're more comfortable with. That's the nice thing about not being multiple choice. But since we have an elevation above that, that would be our articular crest. Okay? Now, you'll notice, and this doesn't show it as well as some of the other animals. I think the pig shows it best, although the kitty cat really, and since you got that magnification factor, shows it nicely. Here's one vertebra, here's another, here's another. Since they fuse together, we don't have intervertebral foramen like we do with the other vertebra. We just have openings. And so these openings are called sacral foramen. Plural of foramen is foramina. So sacral foramina. And some books are really picky and say these are the dorsal, and you flip it over, and the ventral, but really they're the same hole. So sacral foramina is fine. We get down, someone won't show it, but another special feature we see here, this deer shows it fairly well. Once we get to the end, the last pair of cranial articulating processes kind of look like a pair of horns. Cornu means horn, like a unicorn has one horn. So these are called sacral cornua. And the one thing that's kind of hard to visualize, it's actually easier to see in humans, but like you see how big the cornua is on this one side on the cow? It's cow, not hamster, but I figured you knew that. The space encompassed by here is an opening, right? An opening on your work schedule is called a hiatus. So they call this the sacral hiatus, this open area here. Okay, but we can still see our sacral or our neural or vertebral canal through here. All the basic features are still there. Does that help? Does it help to review a little bit? Okay, Dyson, are you